Welcome to Vlogmas Day 9. In today's video, we're diving into some essential NHS Bank registered mental health nurse interview questions and answers. If you're preparing for your interview and want to know how to tackle common questions with confidence, you're in the right place. I'll be sharing sample answers, tips, and strategies to help you make a great impression and land that role. Let's get started. 1. What experience do you have working in mental health nursing? I have 7 years of experience working as a mental health nurse, during which I have cared for individuals across a range of settings, including inpatient units, community mental health teams, and crisis intervention services. This has given me the opportunity to support people with various mental health conditions, such as depression, anxiety disorders, psychosis, and personality disorders. In my previous roles, I have conducted comprehensive mental health assessments, developed individualized care plans in collaboration with patients, administered medications, and provided psychoeducation to support recovery. I am also skilled in crisis management and de-escalation techniques, ensuring patient safety remains a top priority at all times. Throughout my career, I have worked closely with multidisciplinary teams, including psychiatrists, social workers, and occupational therapists, to deliver holistic and person-centered care. My experience has allowed me to build strong therapeutic relationships with patients and their families, fostering trust and promoting positive outcomes. 2. How would you carry out a mental health assessment? Carrying out a mental health assessment requires a structured, empathetic, and professional approach to ensure the individual feels supported and that all relevant information is gathered effectively. I would begin by establishing rapport with the individual, introducing myself and explaining my role. Creating a private and comfortable environment is essential to foster trust and encourage open communication. I would explain the purpose of the assessment, obtain informed consent, and reassure them about confidentiality and how their information will be used. The assessment would start with gathering both subjective and objective data. I would use open-ended questions to explore the individual's thoughts, feelings, and experiences, asking them to describe how they have been feeling recently and any changes they may have noticed in their mood or behavior. At the same time, I would observe their appearance, behavior, speech, mood, and level of engagement to gather objective insights. To ensure a comprehensive assessment, I would use a structured framework like the biopsychosocial model. This would involve exploring their presenting problem, conducting a mental state examination to assess mood, thought processes, perceptions, insight, and cognition, and evaluating risk factors such as self-harm or harm to others. I would also inquire about their physical health, including any medical conditions or substance use, and consider psychosocial factors like their social support network, housing, employment, and relationships. A key part of the assessment would involve engaging the individual in a collaborative discussion about their concerns and priorities. Together, we would identify goals and develop a care plan that reflects their preferences and needs. I believe it is important to empower individuals to take an active role in their care, helping them to feel heard and supported. After completing the assessment, I would document my findings comprehensively and in line with NHS policies. This record would include key observations, identified risks, and agreed upon plans. I would also communicate any relevant information to the multidisciplinary team to ensure the delivery of holistic and coordinated care. Where necessary, I would arrange follow-up appointments or referrals to appropriate services. Finally, I would take time to reflect on the interaction, considering any feedback or areas for improvement in my approach. This reflective practice helps to enhance my skills and ensure I provide the highest standard of care in future assessments. Throughout the process, I would prioritize person-centered care, adhering to professional standards, and working to build a trusting and supportive relationship with the individual. 3. Can you describe a time when you handled a difficult patient? In my previous role, I encountered a situation with a patient who was experiencing acute distress and displaying aggressive behavior. The individual had a history of trauma and was feeling overwhelmed by their circumstances, which made them resistant to engaging with staff. Upon noticing the escalation, I ensured the environment was as safe as possible for both the patient and others in the vicinity, subtly signaling for additional staff support while maintaining a calm and composed demeanor. I approached the patient with empathy, speaking in a calm and non-threatening tone, and maintained appropriate body language to avoid escalating the situation further. I acknowledged their feelings and validated their frustration, emphasizing that I was there to support them rather than impose anything on them. This helped to gradually de-escalate the situation and create a space where the patient felt heard and respected. Once the immediate tension had reduced, I worked collaboratively with the patient to identify their primary concerns and needs. This involved active listening and allowing them to express their emotions fully without interruption. By doing so, I was able to address their specific concerns while reinforcing boundaries to ensure everyone's safety. I also involved the multidisciplinary team when necessary to develop an immediate plan of action that aligned with the patient's care plan. After the incident, I documented the situation thoroughly, highlighting the triggers, my interventions, and the patient's response. I also participated in a debriefing session with colleagues to reflect on what went well and identify areas for improvement. This experience reinforced the importance of staying calm under pressure, employing de-escalation techniques, and maintaining a person-centered approach even in challenging situations. It was a reminder of how critical it is to approach each individual with empathy and patience, particularly during moments of heightened distress. 4. What key tasks do you think you'll have to do as a mental health nurse? As a mental health nurse, I understand that my role involves a variety of key tasks aimed at supporting individuals in managing their mental health challenges and improving their overall well-being. A significant aspect of my role would be building therapeutic relationships with patients, offering empathy, understanding, and encouragement to create a safe and trusting environment where they feel comfortable discussing their feelings and concerns. Conducting comprehensive mental health assessments would be an essential task, involving the evaluation of a patient's mental state, identifying risk factors, and working collaboratively to develop tailored care plans. These plans would aim to address their specific needs and preferences, ensuring that their care is person-centered and holistic. Administering and monitoring treatments, such as medication or psychological therapies, would also be a key responsibility, along with providing education and support to help individuals understand and manage their conditions. I would be responsible for conducting risk assessments and implementing appropriate safeguarding measures to protect individuals from harm, ensuring their safety and the safety of others. This would include recognizing early signs of deterioration in a patient's condition and intervening promptly. Working as part of a multidisciplinary team would be central to my role, collaborating with other healthcare professionals to provide coordinated and effective care. Another important task would be offering support and guidance to families and carers, helping them to understand the individual's condition and equipping them with strategies to provide ongoing support. I would also play an active role in promoting mental health awareness and advocating for my patients' rights, ensuring they are treated with dignity and respect at all times. Additionally, accurate documentation of care, assessments, and interventions is vital to maintain clear communication within the team and ensure accountability. Continuous professional development would be a priority, staying up to date with best practices and evidence-based approaches to provide the highest standard of care. Overall, my focus would be on empowering individuals, promoting recovery, and supporting them in achieving their goals while upholding the values and standards of the NHS. 5. How do you manage stressful or demanding situations? Managing stressful or demanding situations is a key aspect of being a mental health nurse, and I approach such scenarios with the combination of self-awareness, effective strategies, and a professional mindset. First, I focus on maintaining calm and composure, as this helps create a sense of stability and reassurance for both the individuals in my care and my colleagues. I rely on clear prioritization to address immediate concerns first, ensuring safety and well-being are at the forefront of my actions. I also draw upon my training and experience to remain solution-focused, breaking down complex situations into manageable tasks. Effective communication is essential in these moments, and I ensure that I actively listen, convey information clearly, and collaborate with the multidisciplinary team to make informed decisions. To manage stress personally, practice self-care and reflection. After demanding situations, I take the time to process what occurred, seek support from colleagues or supervisors when needed, and apply any lessons learned to future challenges. Staying organized, practicing mindfulness, and maintaining a healthy work-life balance are also important in preventing burnout and sustaining resilience. By staying calm, focused, and reflective, I am able to manage demanding situations effectively, while ensuring the highest standard of care for those I support. 6. How would you handle a situation where a patient refuses their medication? Handling a situation where a patient refuses their medication requires a calm, empathetic, and professional approach that prioritizes patient autonomy while ensuring their safety and well-being. I would begin by remaining calm and non-judgmental, recognizing that medication refusal may stem from a variety of reasons, such as fear, side effects, a lack of understanding, or personal beliefs. Building rapport and maintaining open communication are essential. So I would engage the patient in a conversation to explore their reasons for refusing the medication. I would listen actively to their concerns, ensuring they feel heard and respected, and provide clear, accessible information about the purpose of the medication, how it works, and its potential benefits and side effects. This helps to address any misunderstandings or fears they may have. If the patient still feels hesitant, I would explore alternatives or adjustments, such as changing the timing, dosage, or form of the medication, collaboration with the prescribing team. While supporting the patient's autonomy, I would also assess any risks associated with not taking the medication, including potential harm to themselves or others. If necessary, I would involve the multidisciplinary team to develop a plan that ensures their safety while respecting their rights. In some cases, it may be appropriate to review their capacity to make informed decisions about their treatment, following the Mental Capacity Act and local NHS policies. Throughout this process, I would maintain a person-centered approach, focusing on building trust and working collaboratively with the patient to find a solution that aligns with their preferences and needs. Documenting the situation accurately and thoroughly would be essential, including the patient's concerns, the steps taken to address them, and any outcomes. If needed, I would arrange a follow-up discussion or support to revisit the issue and ensure ongoing care. By approaching the situation with empathy, professionalism, and respect for the patient's autonomy, I aim to balance their rights with the responsibility of delivering safe and effective care. 7. What do you understand about risk management in mental health nursing? Risk management in mental health nursing is a critical process that involves identifying, assessing, and mitigating potential risks to ensure the safety and well-being of individuals receiving care, as well as the safety of staff and the public. It requires a thorough understanding of the complex and dynamic nature of mental health conditions and the various factors that can influence risk. This includes recognizing risks such as self-harm, suicide, harm to others, neglect, and vulnerability due to mental illness. In practice, risk management begins with the comprehensive risk assessment, which involves gathering information from the individual, their family or carers, and other professionals involved in their care. This assessment considers the individual's history, current mental state, environmental factors, and any triggers that may exacerbate their condition. Tools and frameworks, such as risk assessment scales or structured professional judgment, are often used to support this process while ensuring a consistent and evidence-based approach. Risk management is not about eliminating all risks, but about balancing the need for safety with promoting the individual's autonomy and recovery. Effective risk management involves developing a personalized care plan in collaboration with the individual, which includes strategies to mitigate identified risks while respecting their preferences and rights. For example, this might involve implementing safety plans, adjusting medication, involving crisis intervention services, or arranging additional support from community services. Communication is a fundamental aspect of risk management. Regular and clear communication with the multidisciplinary team ensures that all professionals involved are aware of the risks and the agreed-upon strategies to address them. It also requires timely documentation of risk assessments and management plans to maintain accountability and provide a clear record of care. Another key component is ongoing monitoring and review. Risks can change over time, and it is essential to reassess regularly, especially following any significant events or changes in the individual's condition. This dynamic approach ensures that the care plan remains responsive and effective. Finally, risk management also involves a proactive approach to safeguarding, ensuring that any concerns about abuse or neglect are addressed promptly and in accordance with legal and organizational guidelines. As a mental health nurse, I recognize the importance of maintaining a balance between managing risks and fostering an environment of trust and empowerment that supports individuals on their journey to recovery. 8. What motivates you to work in mental health nursing? I am deeply motivated to work in mental health nursing because I have a strong passion for supporting individuals through some of the most challenging times in their lives. Mental health issues can be incredibly isolating and misunderstood, and I am driven by the opportunity to help reduce stigma, provide compassionate care, and make a real difference in someone's recovery journey. I am particularly drawn to the holistic nature of mental health nursing, where I can integrate both my clinical knowledge and empathetic skills to support individuals in a person-centered way. I find it incredibly rewarding to build trusting relationships with patients, listening to their unique experiences, and collaborating with them to create care plans that empower them to take control of their mental health and well-being. In addition, mental health nursing offers a dynamic and evolving environment. I am motivated by the constant learning and development within the field. Whether it's staying up to date with the latest evidence-based practices, mental health interventions, or understanding the complexities of mental health conditions. The opportunity to work within multidisciplinary teams also motivates me, as it allows for a collaborative approach to care that can lead to better outcomes for patients. Overall, what motivates me the most is the chance to make a meaningful impact on individuals' lives, offering support, guidance, and hope, and contributing to their overall mental and emotional well-being. 9. How do you collaborate with a multidisciplinary team? Collaboration with a multidisciplinary team is essential in providing holistic and person-centered care to individuals with mental health needs. As a registered mental health nurse, I believe in the importance of effective communication, mutual respect, and shared decision-making. I would ensure that I am always actively participating in team meetings and discussions, contributing my nursing perspective and insights on the individual's mental health, treatment plan, and any changes in their condition. I would engage with colleagues from various disciplines, such as psychiatrists, psychologists, social workers, occupational therapists, and support staff, recognizing and valuing their expertise. For instance, if a patient is experiencing significant mental health challenges alongside social or housing issues, I would collaborate with social workers to address these concerns while working with psychiatrists or psychologists to manage the individual's clinical needs. This type of collaboration ensures that all aspects of the patient's well-being are considered in the care plan. In addition to team meetings, I would maintain open lines of communication with other professionals. Through daily handovers, written reports, and informal conversations, I would ensure that any changes in the patient's condition or any concerns I have are communicated promptly and clearly, allowing the team to adjust the care plan as necessary. For example, if a patient's mental state deteriorates, I would liaise with the team to implement any immediate interventions and update the care plan to reflect the change. I also make sure to include the patient and their family in the decision-making process, ensuring that their voices are heard within the multidisciplinary team discussions. This collaborative approach promotes a shared understanding of the patient's needs, encourages joint problem solving, and enhances the effectiveness of the care provided. Ultimately, believe that collaboration within the multidisciplinary team ensures that care is comprehensive, cohesive, and person-centered, improving outcomes for the individual. By working together with respect and professionalism, we can ensure that the patient receives the best possible care tailored to their specific needs. 10. What steps do you take to maintain your professional development? Maintaining my professional development is a priority for me as a registered mental health nurse, and I take several steps to ensure I stay updated with the latest practices, theories, and regulations in mental health care. I regularly engage in continuing professional development (CPD) activities, including attending relevant training courses and workshops. These help me deepen my knowledge in specific areas such as mental health conditions, therapeutic interventions, and crisis management. I also make use of online resources and e-learning platforms, which provide flexibility to learn at my own pace, while ensuring I cover important topics in the field. I stay up to date with current research and best practice guidelines, reading journals, articles, and research papers that focus on mental health, nursing. This allows me to integrate evidence-based practices into my work, ensuring I provide the best care possible for service users. Additionally, I take part in peer supervision and regular team meetings, where we discuss cases, share insights, and reflect on our clinical practice. These sessions are valuable for learning from others, discussing challenges, and gaining new perspectives that contribute to my growth as a professional. Another important aspect of my professional development is engaging in reflective practice. I regularly take time to reflect on my own experiences, identifying areas where I can improve and setting personal goals for further development. This helps me stay aware of my strengths and weaknesses, fostering continuous improvement in my practice. I also seek feedback from colleagues and service users, as I believe constructive feedback is an essential tool for personal and professional growth. Lastly, I am committed to ensuring my professional registration is always up to date and comply with any continuing education requirements set by the Nursing and Midwifery Council (NMC). I actively monitor any changes in regulations or standards within the NHS, ensuring my practice adheres to the latest guidelines and policies. By taking these steps, I can maintain my competency, improve my practice, and continue to provide the best possible care for those who need it. Do you have questions? Yes, I do have a few questions. I'm curious about the team dynamics within the mental health services at this particular NHS trust. How does the multidisciplinary team work together to support patients, and how is collaboration encouraged within the team? Additionally, I'd like to understand more about the training and development opportunities available for staff. Are there any specific programs or resources to help nurses further their professional growth in mental health care? Lastly, what does success look like in this role? both in terms of patient outcomes and personal development. Thank you for the opportunity to ask these questions. That's it for today's video on NHS Bank Registered Mental Health Nurse Interview Questions and Answers. I hope these examples and tips help you feel more prepared and confident for your upcoming interview. If you found this video helpful, don't forget to like, comment, and subscribe for more nursing career tips throughout Vlogmas. Let me know in the comments what topics you'd like me to cover next. See you tomorrow for day 10.